we need to be really thinking with good information. Sometimes we twist that into something that we want, and we need to step back from that. I think my mom had the saying of taking 2 steps back and 1 step up. That's why we have this program from the Gerald L. Ignace Health Center, a 30th program, because there's always new information, and old information sometimes gets forgotten, but it's still good information and we need to remember it. So with that, I'm gonna say thank you to each and every one of you, miigwech, for being here. Hawaiian, much appreciation, Yalko, and let's get to the program because we need to prepare ourselves for what's coming in this coming weekend and the week after. So we're gonna turn this one over to Dr. Ignace, and here we go. Dr. Ignace.
Thanks, Mark. Thanks, Jeremiah, and welcome back. As Jeremiah said, this is week 30. And this past week, if we thought couldn't get any worse, it has. But there is light at the tunnel here. As I mentioned last week, there's been several developments that have been going on. This current administration, under the Operation Warp Speed program, has created a pretty diverse profile of vaccines from different biotech companies using different types of technology in creating this. And so in the past, what is it now, 2 weeks, almost the last 10 to 14 days, we've heard a lot about Pfizer. We've heard a lot about Moderna. And something that just came out in the last couple of days is University of Oxford is coming out with very similar messages that Pfizer and Moderna has come out, and saying that they're at the doorstep of releasing their information pretty soon as well. So University of Oxford is in partnership with AstraZeneca. So that is another major development. So that'd be the 3rd biotech company. And just so you know, as I've been talking about vaccines over the last couple of months, these were the 3 leading biotech companies out there that have been leading the efforts. And I think probably shortly as well, the 4th one will be Johnson & Johnson, but we'll see how this goes. So we've heard about Moderna. Pfizer came out, said that there was 90% effective in preventing COVID. And then Moderna came out and said, well, they had a vaccine that was 94.5% effective. They both used the technology of messenger RNA technology. And I'll just kind of quickly go over what that is in a moment. But what recently happened in the last day is Pfizer has now completed their final profile, their safety profile. And what was a bit limiting in their announcement was that at first they said they were 90% effective in preventing infections. They came out yesterday and said, well, after all of the safety profiles and all of the events, infectious events came out, that they are now 95%. So they've gone from 90 to their final report of showing 95% effectiveness in preventing. The reason why that is because they had to reach a plateau, a benchmark number of infections of the people that were enrolled. And with that, you kind of get with that number count that they of infections that they receive. Then they actually look at who got the placebo and who got the vaccine. And what they're saying is 160. There were 170 people who got infected. 162 of those were people that got the placebo. And the other 8 individuals were the people that actually had the vaccine. So when you look at 8 out of 170, you get 95%. So they're now coming out saying they're 95% effective. Now, whether that's 0.5% more than Moderna, or was it 4.5% less than Moderna? Anything in the 90% range is still really effective in prevention. So the other thing that came out, that their efficacy was consistent across age, race, and ethnic demographics. So they obviously have enough profiles enrolled in volunteers to get a very broad perspective, not only across ages, but also race and ethnicities. And that's a very good point, because there's, certainly concern in their enrollment whether or not they were getting enough minority demographics in their profile. And now that they've come out and said, yes, they do, they have, and their efficacy is consistent across the board. So that should certainly give people peace of mind, knowing that this is effective regardless of race or ethnicity. Another point that was made was that in individuals 65 and older were shown to have just as well, their efficacy rates were just as good as younger people, which is great, given how we're going to roll this vaccine out to the population. So this is very important, and it's my understanding of all of the reporting that has been going on is that Pfizer is ready to go with their filing to the FDA for their emergency use authorization as early as tomorrow. So in terms of time frame, what does that mean between submitting and in the hands of the FDA? How long will it take the FDA to review everything? And if they determine that this is not only feasible, but their approval, that whole process, my understanding from what I hear, is going to take about 2 to 3 weeks. Once it gets into the hands of the FDA, it'll take 2 or 3 weeks. And from there, it could happen quite quickly, or it could take the full 3 weeks. It really depends on how quickly the FDA goes through all of the data and all the information to make the determination. So if tomorrow is the day, essentially count 2 to 3 weeks from tomorrow, and then approval, and then there will be it'll be go time to start distributing the vaccine throughout the country. So that's what's going on with Pfizer, Moderna, AstraZeneca with the University of Oxford. They're coming out. So things are moving really, really quickly right now. And as I mentioned last time, the phases at which vaccines are going to be coming out, the priority will be essential healthcare workers, high-risk individuals, and first responders. So what we're talking about is a health infrastructure. You need a healthy workforce to attend our health system to address this virus and COVID. So we're talking about essential healthcare workers. In that same grouping are also high-risk individuals. And these high-risk individuals, we've gone over the list several times, but here's the list. So individuals 65 and older, individuals that live in a nursing home or long-term care facility, or any individual that has chronic lung disease, moderate to severe asthma, serious heart conditions, whether it's congestive heart failure, atrial fibrillation, mitral valve problems, certainly would be candidates for the vaccine. People are immunocompromised, and undergoing cancer treatment or bone marrow transplants or any transplant organ individual, BMIs, severe obesity over 40, and people with chronic conditions such as diabetes, and people with diabetes that have um, kidney problems, liver problems, peripheral vascular problems, eye problems. These are individuals that are high risk. And then we have certainly a list of other individuals who also would be at risk as well. So the important thing to realize is that the vaccine could be on its way to delivery and a campaign sometime in mid-December. So what we know about the vaccine with Pfizer and Moderna is 2 shots, 2 shots for each one. And so it's going to be interesting to see how fast the FDA works, knowing all the information that they have, all of these news press releases that have been going out. If the information is there and they approve it, the vaccine will be here, and that's going to be a great relief if the FDA actually approves this. So that's the headline news going into this week. It'll probably be for the next several weeks until we hear from the FDA. And so there will be no behind closed doors decisions on this. It sounds like it'll be very much of a open, public, transparent approach to dialogue and information. So it's going to be, people are going to know what's going on by the minute, by the day. There won't be too many, it'll be very transparent. And so if the FDA approves this, there really shouldn't be any issues moving forward with its safety and its efficacy. So let's get right into the numbers. And so as of yesterday, worldwide, there's been 56 million cases worldwide, 1.3 million fatalities. Here in the United States, 11.3 million cases. There's been over 166 million tests that has been conducted to date. If you think about it, there's 325 million people here in the United States. I think by this time, 30 weeks into this, 35 weeks into this overall, I'm sure you probably have been tested yourself, or you know someone close to you, family relatives, even household members that have been tested by this point. I've been tested. I told the audience here that I've been tested, and that came out okay. So at least half of the United States has been tested to this point. In terms of fatalities, 247,834 fatalities here in Wisconsin. The confirmed cases are now at 331,000. In terms of recovered, 254,000, and fatalities 2,793. So we know the Native population here in the United States is widespread. Of the 5.2 million identified natives in the United States, nearly half of them utilize the Indian Health Service, and nearly 70% of the native population reside off of the reservation and live in urban settings. So the dynamic of tracking and understanding native health goes beyond just the Indian Health Service. So I give 2 parts to kind of identifying cases throughout the United States. So let's get into the IHS information. So we know in IHS there are 12 areas. They're listed on the far left. And then the next columns, November 17th, we have the total number of cases to date, total tests, and total positives. These are rolling aggregated numbers. So it's kind of hard if you just get into looking at IHS, what the numbers are. You don't get a sense of what the activity has been. So I've been able to track this on a weekly basis and reporting out. So we have a trend of numbers, active cases in the past 7 days, and that's how I've been able to trend this out. So as you look at this, you see yellow highlighted areas for November 17th. These indicate the high active trends that are going on in that area. We see Albuquerque, California, Navajo, Oklahoma City, and Phoenix are rounding out the trajectory of positive cases on the higher end than the week prior. As you go down, you see other areas that are actually either flattening or slowing down. So this week, it's kind of 50-50 in terms of areas activity. But when you add them up, there's been 8,706 new cases of COVID in Indian country. And that's almost 1,000 more than last week. And last week was 2,000 more than the week prior. So as you go through the last 6 weeks, there's been an obvious progression and acceleration of active cases, nearly doubling the number of cases in 6 weeks, which is pretty remarkable. How fast and diffuse this virus has run through Indian country. When you go to the far right, the second column, you see the 7-day average positivity rate. So this kind of gives you a sense of the positivity rate of cases tested over the number of cases positive to the overall number of tests done. You see that the average for all the areas is 12.1%. We see some areas below that and some very much above that average. We see the Great Plains has a 25% 7-day positivity rate, which is really, really high, the highest of all the native areas in the country. So right now we have different trends that are going on. I think last week the trends were pretty consistent. A lot of the areas were up. Now we have areas that are plateauing, that remain flat. Some have gone down and some have continued to go up. And just of interest here, we see that Navajo had 1,180 cases this week. At one point, I know at one point that Navajo had acknowledged that they had zero cases for a couple of days, and that was in September. However, since then, Navajo has continued to accelerate in cases and really exponentially have increased over the last 4 weeks. So this is really dynamic. So what we thought was high in Navajo in July, we have 3 areas that are really high now in weekly cases, and that's the Great Plains, Navajo, Oklahoma City. And I'm starting to notice that Phoenix is starting to increase their number of cases as well. So mixed bag of cases this week for sure. Overall, it's up. Here we're looking at Bemidji, Great Plains, and Billings, and comparing that to what the public health departments are reporting out per state. We see like Wisconsin alone has 4,360 cases overall. Sorry about that. So we see that Wisconsin has 4,360 cases, and that's, if you just take Wisconsin alone, that almost makes up 80% of what Bemidji is seeing overall. But when we start adding Minnesota, Michigan, Illinois, we now have an accumulated case total of 8,526. So nearly 3,000 cases, native cases, are being diagnosed outside of the Indian health system, just in the Bemidji area. If we look at Great Plains, they have 9,200 cases. And if we look at the overall total, we're almost talking 13,000 if we take the accumulator approach. And so another 4,000 cases are diagnosed outside of Indian Health Service, and nearly 1,500 cases outside of the IHS and Billings area. So when we look at sources of information, of data, of numbers, you really need to look at everything and not just one source, because that one source, Indian Health Service, just confirms, or at least acknowledges confirmed cases utilized by their own facility. So this, I've taken the approach of looking at both the private public health service as well as IHS, and we see that the accumulated cases are much higher when we include outside of our federal, tribal, and urban programs. Looking at the region overall, we see Wisconsin with its numbers and almost 4,600 cases in the past week, 6,500 cases per day. We now have Michigan exceeding Wisconsin. Indiana is not far behind. Illinois has exceeded everyone's daily case over the past week. And we see that Minnesota is kind of creeping up as well, close to Wisconsin's numbers. So everyone in the upper Midwest is being impacted, just like the Great Plains as well. So what was mainly just Illinois, Wisconsin, not too long ago, 2-3 weeks ago, now is everybody in the upper Midwest. So it's important to look at this in a broader sense, other than that's what I've tried to do, and at least assure this audience that they're getting a broader picture of what's, other than just what's happening here in Wisconsin. So this is information from the Indian Health Service from the Bemidji area, which includes Minnesota, Wisconsin, and Michigan. Nationwide, the positivity rate is 10.5. That's up from 9.3% the week prior. The positivity rate in Bemidji, 11.7 overall. We look at Michigan, the positivity rate has gone up by 1.9%. In Minnesota, it's gone up by 1.2%. However, even though Wisconsin's positivity rate is higher, it actually has gone down to 34.7, so 1.2% reduction. So I had mentioned in the past several weeks, Wisconsin has been, without a doubt, a hot spot in terms of cases. It has been accelerating, and I had noticed a few things that would maybe indicate that maybe Wisconsin is starting to plateau, and maybe it is. Maybe it is. We'll see. But at the same time, I had also noticed that Michigan and Minnesota were much lower in their cases and their positivity rate. However, I thought they were maybe like 2 or 3 weeks behind Wisconsin, and I think that's what's going to happen. And I'll get to that here shortly and show you that. But so Wisconsin's positivity rate may have hit a peak. We'll see. We'll see how the next week goes. My sense is that if the numbers go as we've seen today, that maybe this may be the peak. And Michigan and Minnesota have just started, so we may be the kind of a front runner in terms of activity compared to the other two states. So definitely keep an eye out for that. Cases per 100,000 by county. Now, there's 3,141 counties in the 50 states. Looking at just the Bemidji area alone, we see that the state of Michigan, the county of Baraga, that is home to Kewanee tribe. They're ranked 61 in the country. When we look at Wisconsin, we see Jackson, Menominee County, and Barron County. These are the only counties that rank high in the state, and these are home to Ho-Chunk, Menominee, and St. Croix. You can see what rank they are: 35, 37, 38 in the country. Out of 3,100 counties in the country, they are in that very top hotspot tier. When we look at Minnesota, Clearwater, Douglas, and Caledonia. Did I say that right? Candahoya, Ohi County. No tribes are affiliated with these counties, but like I had mentioned, Michigan and Minnesota are starting to creep up in their positivity rate and the number of cases per week. So could they be catching up to Wisconsin? And that's quite possible. But this week we have 4 tribes in the top 100 hottest spots in the country. So very concerning for these 4 tribes. Looking a little more specifically at the tribes of Michigan with their respective counties. In yellow, you see the aggregated number of cases to date. And I trend the numbers out on a weekly basis. So on the far right, you see a second column of highlighted yellow. That is the number of new cases in that county with respect to that tribe in the past 7 days. So here, the trend is different this week for Michigan. We see that there are more tribes, or at least more counties, that are increasing in their number count. Some have decreased, and Hannahville has flattened their numbers. When we look at the total population, total native population, 1,382 cases aggregated, 195 diagnosed in the past week. It's a 16.4% increase from the week prior. And when we look at the overall population of native cases, we see that is now makes up 2.3% of the native population of Michigan. Looking at Minnesota, as we go left to right, we see the tribes with their respective counties. In the first column that's highlighted yellow, we see the aggregated number of cases to date, followed by the second column in highlighted yellow is the number of new cases in the last 7 days. And you can just see up and down the trend line that the number of cases in each respective county has shown to be going upwards. Minnesota now has 2,068 cases, 368 new cases in the past week. That's a 21.6% increase from the week prior. Looking at cases to population, we see that Minnesota's native population is 2.5% of confirmed cases of coronavirus. Looking at Wisconsin. Wisconsin, we have the tribe with the associated county, and first highlighted is the aggregated number to date, with the second column highlighted in yellow is the number of new cases in the past week. A little different picture for Wisconsin this week than last week. Everyone last week was going up. However, it appears that these counties may be plateauing, and we see that the overall number is 4,360 with 579 new cases this week. Slightly lower, but when you look at it from a number standpoint, it's a flat. There's no significant up or down. Pretty much flat number compared to the week prior. 15.3% increase compared to the overall estimated population of the state The number of native cases is now at 8.4%. So I just gone through numbers, confirmed native cases by state health department. We know Michigan, 1,382, Minnesota 2,068, and Wisconsin has 4,360, more than Michigan and Minnesota combined. Now, again, I had mentioned that Wisconsin was a hotspot and has been a hotspot for at least a good 4 or 5 weeks now. Are the number of cases, have they exceeded Michigan and Minnesota? Because we're all pretty much equal up until about 2.5 months ago. However, Wisconsin has surged in the number of cases. Are we starting to see a plateau in these numbers? And it's quite possible we may be plateauing, and maybe Michigan and Minnesota are going to start increasing in their numbers, which looking at the data certainly would indicate that they've just started. They've just started their surge, and so numbers could get much higher for the native population in those two respective states. As I mentioned, here in Wisconsin, we talked about Menominee, we talked about St. Croix and Ho-Chunk as hotspots. But when we look a little more closely in terms of the cases per 100,000 in the state of Wisconsin, we see the Fox Valley that highlighted, the darker blue highlighted dense areas. Those are the areas that have the highest incidence rates in the state. So we see that in the Fox Valley, we're talking about Stockbridge, Menominee, Oneida, Saucon, as well as Forest County, Potawatomi. So we're dealing with an area which in respect to the tribes is really in their backyards. And so this is going into, the next several weeks. The dynamic of the number of cases that are occurring could get worse. Could get worse for these tribes. This is just a heat map looking at the country as a whole, and we see the outline of Wisconsin with a lot of red. Those are counties. Those are red counties in the country, and we see that just Wisconsin as a hotspot, just really a really concentrated area of ongoing cases in these counties. Looking at cases per 100,000 by state, we see in the country, North Dakota is ranked number 1, South Dakota number 2, Minnesota is now number 5. They've increased, they jumped up 3 states. Minnesota's number 5. Wisconsin's dropped to number 7. They dropped 2 states, and Michigan is slowly moving up as well to 18th state in the country, moving up 2 spots. Now, these 2 columns, these 2 tables on the right-hand side, November 11th and November 18th, when you start comparing week to week, we see definite changes that are occurring. Every state is increasing. Some are increasing at a much faster rate. So we see November 11th, Wisconsin had 42,780. By November 18th, in the past week, we're at 48,343. We've increased, but if you look at all the other states, Illinois, Texas, California, Georgia, Michigan, Ohio, they have increased even faster, higher numbers than even Wisconsin has. So even though we may be dropping, okay, we are still adding more and more cases. It's just that the other states are increasing at a much faster rate than we are, and you can see that for every state. These are just of the top 20 states here in the country, But you can see, you compare week to week, every state is increasing. Some are accelerating faster than others, and that's why Wisconsin is being bumped down, even though we are increasing our numbers on a weekly basis. So everyone is increasing, and some are just increasing a lot faster than others. So that's what we're seeing right now. Here in Wisconsin, 4,271 cases. Sadly, this week has been pretty devastating for the state of Wisconsin and the Native communities. There's been 7 new fatalities this week. That is the highest number of fatalities in the last, since I've been reporting. We've never had more than 1 or 2 fatalities a week. However, this week there's been 7. So that is pretty dramatic increase for the state of Wisconsin. And sadly, one of my relatives is one of these cases, and it's really unfortunate, and had occurred just 2 days ago. So I think we all, at this point, probably know someone who either has had the virus or family friend who's had the virus, and we're probably going to be pretty close to everyone, at least knowing someone close or family friend that has passed away from the virus. So believe me, this impacts everyone. In terms of demographics, as the weeks have gone by since September, back in early September, the trend was 20-year-olds and teenagers. They were the ones that had the highest rates of infection as the weeks have gone by. October started to change. We started not only getting more cases, but the rate of cases was starting to spread out more evenly. A little different now, mid-November, November 18th, we're starting to see that younger age group now exhibiting little higher rates than the other age groups. So I don't know if this is just another point in time where, yes, cases are increasing, but again, all of the cases are in the young and teenagers. But now we're starting to add in the 0 to 9-year-olds as well. So you see such a huge dramatic increase, more than a 12-fold increase in the 0 to 9-year-olds, 5-fold increase in the teenagers, and a 7-fold increase in the 20-year-olds in September. So are we getting to another point in time where it's now going to be predominantly young people again? It's quite possible. At least that's what the numbers are showing right now, that it's starting to trend a little bit more into that younger population again. So I had mentioned that this is the 7-day average. We are now averaging 6,563 cases. So we've had, as you can see in the dark blue line, today we only had 6,600. That's not reflective of this, but 6,600 cases today. I know a couple of days ago we almost had, or was that yesterday, we had almost 8,000 cases. So that's a pretty wide swing from 8,000 to 6,600. Is this our plateau? Are we plateauing right now? It's certainly not for the lack of testing. We are testing. Our agency here is testing tremendously. It's certainly not for lack of testing. I think anyone who ever wants a test can get a test. It's just this trajectory, this line trajectory is kind of, is just a hiccup, and it's just going to keep going up. Well, today's number would indicate that perhaps we're we're peaking. Perhaps Wisconsin is peaking, and it's possible. I think, today's Thursday, Friday, Saturday, going into the weekend, the numbers tend to be reflective of the week. Sunday, Monday's numbers that come out tend to be reflective of Friday, Saturday. Tuesday would be the best way to indicate whether or not we're going to just keep going up, or are we plateauing and trending downwards. I think the next 4 days will determine whether or not we've reached that high water mark, but we'll see how these numbers play out. So we're going into the weekend, and we'll see how we come out on the other side. On Tuesday's numbers will be a better indication of what's going on. A little different profile I wanted to present today. Primarily the one in the middle. So we see Milwaukee County. This is the number of hospitalizations in the last 7 days. Now, what you see in this is it's different, and I didn't expect this, because the bigger the circle, the higher number of cases for hospitalization. Now, what runs counter to this is that when we look at different maps, we see the highest concentration of admissions tends to hover around where Milwaukee is printed there. That's where the highest concentration of cases appear to occur. But that's not reflective in the number of hospitalizations that are occurring in Milwaukee. So as you can see, we see much further south. There are more admissions coming from further south as well as further north. And that's almost kind of counterintuitive of what we're seeing in terms of number of cases, because most of these cases are more central to the city, just north and just south of the highway, where a good portion of the cases tend to occur. That's not where most of the hospitalizations are coming from. They're coming from further north or further south. So I thought that was certainly a different dynamic of looking at not just at the sheer number of cases, but just where people are being admitted from. So they don't necessarily match, and so it's a different observation of the activity that is actively going on now. One other thing when it comes to hospitalization. So if you look to the right of center column, you see hospitalizations by age range. We see very few admissions coming from basically 30 years, 40 years of age and younger. The number of hospitalizations really don't start going up until we see 70 and older. So in the past week, we've had 48 admissions just from Milwaukee County alone. 29 or nearly 75% of all the admissions have occurred in the 70 and older age range. And so again, when you look at the hospitalizations that are occurring, we're seeing that the majority are occurring in 70 and older. So when we look at the map, where are these places? Could these be nursing homes? Could these be long-term care facility areas that we're seeing being admitted from? And that's certainly possible. That's certainly possible of where and who we are seeing being admitted to the hospital. When we look at the number of fatalities, 45 in the past week, we see one 40-year-old, none 30 or younger, and then we start seeing it increasing at the age of 60. We see 70, 80-year-old plus making up 35 of the 45 fatalities. So again, we're seeing the impact of outcome devastating for the 70 and older age group. So it's important when you see numbers or news outlets that report numbers. Yes, it's nice to know overall, but it gives, if you can get more context as to, you know, who's impacted and where you know, cases and hospitalizations are occurring, you get a much different picture or a much different sense of the level of activity and who's being impacted the most. New positive cases per day. So the yellow bar is the 7-day average. And no surprise here, you know, when we were talking back in April and July, averages at that time seemed kind of high. You know, we far exceeded that number now. And so as you go through month of September and October and up to November 11th, the 7-day average for November 11th is 1,061. You see this sharp decline in the number of cases here in Milwaukee. Mainly, this is not what is actually occurring. There is a delay. There's a delay in reporting cases. So anywhere from 5 to 7 days. So that sharp decrease in that yellow line isn't an indication that it's, you know, this is over. No, it is just an indication that there is a delay in reporting out on everyone that's being tested. So November 11th, that is that's probably going to be our high watermark right now. I think as the days go by, that number will tell us more about where Milwaukee County is going to be trending out towards. This is looking a little more locally to the city of Milwaukee. Again, that sharp decline in the yellow bar, just an indication of the delay in reporting in the numbers. And then the two counties with the highest aggregated number of cases in zip code 204 and 215. That's where the majority of cases are occurring in the city of Milwaukee. So latest numbers on the number of native cases in Milwaukee County, 277. And this is a profile of getting more context to the activity that is occurring in the state of Wisconsin. So I'll quickly go through this because I know I've talked through this before. There's a lot of numbers here, but if you look at the lower half of this profile, if you just track the yellow bar on the left-hand side, you see this is broken out by age group, by the number of estimated people in that age group, the number of cases, and you get a case rate. So if you look at it, the yellow bar, nearly 6% of the state of Wisconsin, 6% of the state of Wisconsin has a confirmed coronavirus test. And as you go from left to right, we see the number of people being admitted by age group, and we get the hospitalization rate, as well as the ICU rate and the fatality rate by age group. Again, we have not seen any fatalities in the K through 12 age group, none. 13 in the 20-year-olds, and then with each age group, the overall number. So that gives you an aggregated sense of what's going on to date. Now, in the past week, if you go to the right side of this lower half, if you focus on the green bar, again, we have the age group breakout, the number of cases by age group, and then we have hospitalization rate, ICU, and fatality rate. So now, in the past week, we've had over 46,000 cases here in Wisconsin. Now we have context as to what's going on, who's impacted, and what age groups are obviously have the biggest impact of all. So as age groups go up, we see the number of hospitalizations go up. In terms of ICU, we see the number of ICU admissions goes dramatically up once you get to the age of 60. And then fatality rates, we see the numbers dramatically go up once you get to 60 and higher, where the majority of fatalities are occurring in the population of 80 or higher. Nearly 54% of all fatalities related to COVID are in this age group 80 or older. If we were to include the 70-year-old age group in this, we'd be looking at 81% of all fatalities are occurring in this age group. And then 94% of all fatalities are 60 and older. So now we have context into all of the cases and the activity that's going on. And as Mark had mentioned in the beginning, I can talk about what the activity is going on. And Mark had brought up a point of younger people, they're not any less likely to be any less likely to get it. This is a contagious virus. But I think the point that Mark was making was that we know that younger people aren't going to be impacted by hospitalization or fatalities. But what I think the comment was to look at more closely is our elder population that have more chronic conditions, serious chronic conditions. And this is the age group that we have to be even more protective in prevention and minimizing interactions and connections with it that could transmit the virus to. And because it's this age group that's going to have the most serious impacts, whether that be hospitalizations to the hospital, to the ICU, or even worse, succumbing to this virus. So, we have a lot to talk about when it comes to the holiday season that's coming. The number of cases that are occurring, who is the most likely to have maybe a tough go of this infection, this virus, is that older population. Younger population, they do quite fine. It's the older population that is dramatically more impacted than any other age group. We're talking about the 60 and older age group. So these are the individuals we need to look at of how we protect the most. So as a reminder, the signs and symptoms of coronavirus are not just having a fever or having a cough. It could be a multitude of a lot of things. It could be a headache, runny nose, muscle aches, fatigue. I have a sore throat. I have chills, body aches, loss of smell or taste, GI problems such as diarrhea, nausea, vomiting, and even abdominal pain from cramping. What also is on this list, and more than 10% of cases have absolutely no symptoms at all. So you could certainly be an individual that has no symptoms and visit a household, and you don't have to have symptoms to spread the virus. And that's the most alarming part of this. And I think what Mark was alluding to is young people may get the infection. They may not even show any symptoms. We may not even know they actually have it. But if they're interacting in other households, in other areas, other circles of friends who go to one house or another, we could be talking about another dynamic surge event in short order. We wouldn't see it today. We would see it 5-7 days from that interaction, because we know it would take about 5 or 7 days from a contact to actually having the virus exhibit any signs or symptoms. So the immediate, there would be no indication, but it's the 5-7 days later that would be that from people's exposure, 5 to 7 days later, where that virus could actually start exhibiting symptoms in people. And so as difficult as this may be for this upcoming holiday season, I know the CDC just came out with recommendations, and they're actually recommending no travel this Thanksgiving. They just came out with that maybe an hour before this presentation. So that's the kind of arena we're dealing with. And it's quite obvious the CDC feels that at this particular moment, the surge that is going throughout the entire country, multiple millions of people expected to gather for this Thanksgiving. Whatever you think is going on now in terms of activity could even surge even more. And it's not Thanksgiving weekend that it's going to occur. It's going to be the weekend after Thanksgiving, where we are going to see more cases. So CDC is trying to be as proactive in preventing this by coming out and saying they do not recommend any travel for this Thanksgiving. That's not to say you can't have a Thanksgiving. You certainly can. It may be just with a smaller group, or if there is going to be family get together, that it be in maybe in as minimal contact as possible, and maybe it's meet and greet, and maybe that's all that is affordable to give right now, given how serious this surge is right now. So with that, Mark and Jeremiah, I'll turn this back over to you guys, and we can address any comments or discussions or questions.
All right, Dr. Ignace, I hope you can hear me. Second here.
I hear you.
Okay, good. Here's a question, and it actually comes from one of the families related to Menominee Families North. Recently, an article came out from Denmark, and they're not asking you to be an expert in all things from Denmark, but there was an article about a mutation that occurred in COVID-19 and affected their mink farms. And the country is going to be killing 11.5 million of their mink in one fell swoop. Now, how that affects us here in Wisconsin is we have mink farms, and mink certainly in Wisconsin. We have trappers actively that help make a living out there to do it. And we also know that from the Department of Agriculture in Wisconsin, over 2,000 mink have died from it, more have been affected. Now, what it's called in the literature is SARS-CoV-2. So here's the question from the family and their own concern about the trappers and their family. And then now understanding they're about to go about their work in a couple months,
Yeah.
going out there and doing it. We think, or there's issues out there about that COVID-19 went from animals to humans to made that jump. That's the assumption, things I've been reading. And now either this is an article about the COVID-19 jumping from humans to a certain animal population and it's deadly, or is it within that population, a mutation has occurred inside it and now is potentially going to affect humans differently. There's a lot of supposition in there.
Yeah.
But it is a concern. And so basically, are we looking at something new?
Mm-hmm.
Is this something to be concerned about, in particular when we amass all of animals in one particular place and lots of interaction, and here we go off to the virus is doing what they do, which is mutate. So I'll let you take that and take the best stab you can at that one. But it was a real concern from the family, and I just said I would ask during the program.
Yeah, so I've heard that as well. I haven't read any specific articles. I just know, that has been occurring in Denmark and the mink population there. What's kind of unusual about this is that the mink population at least appears to be at least this devastated by the virus. I haven't heard of any other animal population that's been so vastly affected by this virus. And it would be interesting to see what comes out of this, because I really don't know. Is it because of the mutated virus, as was mentioned, or are they? Is this animal population just really susceptible to this type of virus? And why does this not occur in other animal populations? Or maybe it has. We just don't know about everything that's going on in the animal kingdom. But I don't have a good straight answer regarding this. If it's due to a mutation or if it's just due to just being more susceptible, I just don't know.
So we'll just keep an eye on that one for that family, because it certainly, we know that when it came to it became a serious thing for the deer population. If folks might remember, it's a deer wasting disease, they called it, where it came in deer farms, and then it rapidly struck our wild populations. Yeah. And spread throughout the state quickly. So it is a bit concerning for the family and the trappers out there. So we'll keep our eyes on it.
If the DNR comes out, I'd be really interested to see what stance or comments the DNR comes out with regarding that.
Yeah, good. So back to kind of the family questions about the Thanksgiving sort of gathering. So here's the supposition from the same family that wanted to send their kids over to grandma and grandpa because they're going to be fine. And I saw that conversation again over several places.
Yeah.
But then the next question was, okay, if we go, we're going to show up to the Gerald L. Ignace Health Center just to be sure, and we're going to get in line and get tested. We don't have any symptoms. Kids seem to be fine. But hey, we're going to take that test a day, let's say Monday. We'll probably get our results Tuesday, Wednesday. We get all clear. We're all headed out. So what might your perspectives be on that kind of thinking?
Yeah, so I've heard people kind of going about, assuring safety. Here's the problem. Not that I have a problem doing this. Here's the problem after you get the test. So getting the test on Monday and waiting for your results that would come back, let's say Wednesday. So the day you take the test, it will tell you that moment whether or not you actively have the virus. Okay. Now here's the problem. Now, let's say on Sunday, the Packers are playing, and you're hanging out with your buddies, and the evening was fun. You go home, no problems. Come Monday, you said, well, we got to do our pre-testing before we go to grandma's. So, well, that one guy gets a test, the whole family gets the test just to make sure. The problem with that is in the moment, it will tell you whether or not there's active coronavirus. The problem is your exposure from that test, at least 3 to 5 days. It takes 3 to 5 days. If there was an active infection occurring, it would take 3 to 5 days for it to actually show. So there's the dilemma. You may have hung out with your buddies on Sunday. Someone there, let's say it was positive there, nobody knows it. You get tested on Monday, it comes back negative. Well, come Wednesday, Thursday, you start showing signs or symptoms, but you'll say, well, I got tested on Monday. There's a time frame gap between exposure and symptoms and testing of that day. Now, let's say that's a dilemma. That is a dilemma. And so people can transmit the virus even if they've tested negative. They just missed the window of opportunity to actually test properly. That's one issue. The second thing, and I know people are trying to use testing as a way of okaying a family get together. Now, like I just mentioned, you test on Monday, you have no signs or symptoms, you test on Monday, and it comes back Wednesday, and the results come back Wednesday. It says, okay, you're negative. Between Monday and Thursday, if you're going to get tested, you should isolate yourself, even if you don't have any signs or symptoms. Because what you do the minute after the test is taken, Tuesday, Wednesday, if you're not isolating, you could expose yourself somewhere along the line up until Thursday. So the tests are good. They're very good. The problem is the timing of the testing and what you need to do after you test and quarantine, because a test on a Monday, if it takes 3 days for you to get the results back and it shows that you're positive, but on Tuesday, Wednesday, you've been out and about, and maybe you don't get the results in time when you go to grandma's, and Thursday while you're eating, you get a call from the health department that says, hey, Mr. Jones, your test is positive and you've got to spit out your turkey and you've got to leave. Cat's already out of the bag, and it's already too late. So the risk of exposure in that delay could be just as devastating.
A follow-up question on that one, and then I'm going to go to Jeremiah with it. He's got a couple questions in the waiting room here. Following that line of thinking, next piece is, hey, we got someone that just got over COVID-19. They're doing dandy, and they feel free to go, and they're going to visit all the Thanksgiving gatherings in their family structures. You know, Native family being who we are. You know, we got more than 2 families, a lot of us. You know, we get adopted by their families through ceremony or just straight up adoption. Hey, we're doing 4 or 5 families and barely time to visit them all, but we try to do it. Now that person who's recovered says, I'm fine. Now I'm going to go hit all the parties. What would you have to say to that person? And Jeremiah, we'll go to the 2 questions in the waiting room after this.
So what I would say to an individual that has a test positive for COVID, let's say they went through all their symptoms, they come out fine, everything's good, they feel healthy, no problems. For that individual, everything should be roses. The problem is there is a time frame between onset of symptoms and to recovery. Now, I know the CDC's come out and said, well, you should be fine. Your risk of transmission should be fine, you know, after your fever has broken. It seems to be that having a fever is a prerequisite to transmission of virus. So the problem with that is after your fever breaks, you could still transmit the virus, maybe not at a higher rate than when you were having a fever to when you're not having the fever, but with time, that risk goes down and down and down. Now, to be safe, now normally as a healthcare worker at our facility, we do a test-based strategy. So we do symptom-based testing. What this does, it allows us a higher pre-test probability based on symptoms to testing. Now, as a healthcare provider, we don't allow employees to come back until they've actually tested negative twice. Now, this may not be the norm right now, but it has shown to be effective for our facility. The reason being is that after about 10 days, people's risk of transmission goes way down, perhaps less than 5%. Now, the problem with that is, as a healthcare provider, I see a lot of people. So if I got positive and I say, okay, I'm going to come back after 10 days, my risk of transmission is less than 5%. As a provider, and I may see 15, 20 people a day, I have the potential risk of continuing that chain of infection to the people that I see. So we do a two-test negative strategy here on return to work. You need to have 2 negative tests. Reason being is I'd rather be more absolute in assuring that the people that we see as providers are absolutely negative than presumed to be negative with less than 5% chance. I don't want to risk that specifically because we see people who need to see their doctors that have chronic care conditions. And so I can't afford or think that we're continuing this transmission on less than 5% chance that I'm spreading it. That's even too high, given what I know of our population, that I don't want to continue risking that. So that's what we do. I know that's what most places don't do, but that's the long answer to 2 weeks, 14 days. 14 days from test positive. After those 14 days, you should be fine to be able, you will still need to wear a mask and protection. But again, after 14 days from test positive, you should be in the clear to go about your business.
Jeremiah, we're going to go over to you to the 2 questions, if you could, and then we'll come back with the announcement for our community. All right, Jeremiah.
Thanks, Mark. So we're going to go back all the way to the beginning of the session here when we were talking about vaccines. Mm-hmm. And we had a question that was, you had a quote that was, there were the 10 severe cases of COVID observed in the trial, 9 cases occurring. And there was a question just, with the severe group, are they saying it was an effective response, meaning less symptoms, or higher immunity for a second exposure?
No, what I'm saying is they observed in the group that got the placebo shot, they observed them have 10 cases were of severe, or at least 9 of the 10 were of severe nature. 1 who actually got the vaccine actually had a severe case of the virus. So but again, what they're saying is that it is 95% effective. There is still a 5% chance that you still could get COVID, and how you still could get it, but it may be mild symptoms, or in this particular case, it actually progressed to a severe case. Whether or not that was a fatality, I don't know. But at least one person who got the COVID with the vaccine went on to progress in severe. So if anything, it shows that it reduces, dramatically reduces your chances of severe COVID versus not getting the vaccine.
Okay, and then we had another question come in from Facebook, who it sounded like from a healthcare worker herself, and she was asking about gender kind of statistics. And I think you've shown them in Milwaukee specifically, but she said herself she had 7 COVID patients, 4 were women, 3 were men. All 4 of the women recovered with limited symptoms, and the 3 men had far worse symptoms, and unfortunately all 3 men passed.
Yeah.
Overall, have you noticed a vast difference, I think, between male and female, and then even maybe more specifically in Native population between male and females?
Yeah, the last part of that is there is no delineation in breakout of racial ethnic demographics there, between genders in these racial ethnic groups. They do break out gender-wise overall, and so what we know is that there's about a 3 percentage point difference of women getting COVID to men. So more women get COVID than men. Okay. However, when it comes to fatalities, it's reversed. Even though less men get the virus, not a lot less, but a little less, we're seeing almost a 10 percentage point difference between men having fatality to women. Now, why is that? Well, that would be a nice thing to know, and it may help delineate as to why that would occur. So what I'm getting at is, in terms of fatalities, men versus women, I guess you would need to look at specifically kind of comparing apples to apples. You would need to look at age group, and you would need to match everybody up by disease. So let's say 70-year-old female, 70-year-old male, comparing apples to apples, looking at both male and female. Are they smokers? Do they have cardiovascular disease? Do they have kidney disease? Do they have diabetes, hypertension? They would have to have all of the same chronic care conditions to be able to compare one group to another and try to identify if there is any gender difference. Could we be seeing that there is a real propensity for men to die from COVID? That's hard to say, because it's hard enough for men to go see doctors in the first place, and are men as active as women in controlling their underlying health conditions? You could make an argument, both ways, and I've seen, both be true. I just don't know why it is, and I'm sure at some point the researchers and the data collectors and studies that will come out may help explain why this is. But as of right now, about 52% of women in Wisconsin to 48% get COVID here in Wisconsin. So more women get it. But in the reverse, there are more fatalities. 55% of males die versus 45% of females die from coronavirus. I don't think anyone has ever come up with a good hypothesis as to why that is. It's just what we're seeing.
Okay, thanks. And yeah, Mark, if you got an announcement to make about.
I do. Jeremiah's got a screen he's going to share with everyone, and the Ignace Center certainly has been a part of what we've been doing for the Milwaukee community and our Native community since spring. And that is something that we've been calling Unity Fires. These are 4-day fires, 4 days, 4 nights for our community. And this time it's going to be hosted at the Indian Community School. Because of the uptick in COVID-19, we've been running ceremonies at these at a regular time. And because the guys who've been, and women that have been running these ceremonies are older and within that risk group that Dr. Ignace has been talking about, they're going to be doing their ceremonies closer to home and not on site. So what I'm also adding to this is if people want to come with their tobacco and prayer, certainly they're welcome to do it. The stay will be shortened a bit. Everything's outside, and we're going to be trying to limit our gathering to 10. I think we've heard that coming out of Madison. We're sticking to that. Mostly it'll be fire keepers, but when people see this going about our community and the notice, we want you to know that we're still going through with it. We're just going to do it differently, and we'll probably be doing some of our lessons and teachings online. So just be aware of that and know that to date, we have had over 48 ceremonies with tobacco and our fire and water for our Milwaukee and our Native community here in our surrounding area. And we're going to continue that. There was a promise made at the first fire that we would continue that until a vaccine was announced. It looks like we're at that moment now. So for this round of Unity Fires, this will probably be our last one for a while unless something unusual happens. But we want to make sure everyone's safe. We want to make sure that we're following the guidelines, as your family, I hope, does, from the Gerald L. Ignace Health Center. Meaning if you're going to gather together, you keep it outside, you're wearing masks, and sanitizer is available, and you're keeping social distance. Those are exactly the things that we're going to do here. I do know some families said they want to set up and have their outdoor gathering on the athletic fields of the Indian Community School while this fire is happening, because they don't have the room at their, maybe they have apartments or the backyard won't hold the people they want to have. And we're going to be open to that, but we want to keep that limited, and we want people to be thinking about the number of folks they have over under their canopies. So once again, everybody, thank you for making sure in the Gerald L. Ignace Health Center that the answers to COVID-19, not just about the physical challenges of COVID-19, but there's also the emotional fallout that a lot of us are having, experiencing, and yet to experience and are coming. There's also the mental health piece that the health center and all of us are aware of that we're trying to keep up on, but also the spiritual piece. The Indian Health Center here in Milwaukee has been having their own fires, their own ceremonies, their own get-togethers for the spiritual well-being of our community. So I wanted to thank the Ignace Health Center directly and right now for supporting these fires. Recently, they gave us 400 bottles of hand sanitizer to be handed out to our community. Those that we had left over, we handed those off to Wade Fernandez, who himself is doing a COVID-19 program and goes to community centers and does trainings in how to keep oneself safe. Lastly, before I do my final announcement, is that for all the tribal members that are out there that are Oneida, Southeast Oneida Tribal Services, starting at 9 o'clock tomorrow, I believe this will be their last day, is handing out gift certificates for food. I think it's over $100 that you can get as an Oneida tribal member. So if you're an Oneida tribal member, you got your enrollment card or something that can be checked there, please come over. Those are your groceries. That is your nation looking out after you. And they want to extend that helping hand tomorrow at Southeast Oneida Tribal Services. So for those Oneida folks, nation members in the area that haven't taken advantage of this program already, please come check it out for you and your family. So we can take that out off the screen there, Jeremiah. Thank you for that. In order to heal, we must know the wound. And that's what we're trying to do here, everyone, is we got to know what's affecting us. And that's why we've been doing this for 30 weeks. And next week, it'll be going over 30 weeks. And every program is different. Every program has different information. Thank you for being with us. And as usual, Dr. Ignace, we're going to go to you for a final message for our community. And everyone, take care and make those good and responsible plans for the upcoming holiday of next week. Thank you.
Thanks, Mark. This upcoming week, and not just this weekend, but I think every weekend from now to New Year's, there's going to need to be a higher level of precaution that I think everyone will need to take. Now, I know this sounds bad and maybe silly or even dumb, but I think if there even is a propensity or even an inkling of thought that there may be a risk, it wouldn't be a bad idea upon visiting the house that maybe there is masks available. And I'm particularly talking and speaking to elders. Even if it's a short visit, 10, 15 minutes wearing a mask, I think could dramatically reduce the risk of not only getting ill, but having severe outcome as a result. It will be short term, because as I mentioned, there is light at the end of the tunnel here. And we're getting closer to that with the new therapeutics that are coming out, as well as the vaccines that are coming out and more than likely going to be approved by the FDA. We'll be able to enjoy those gatherings, and it will be unfortunate this year that we may have to have smaller events, and maybe it's just the immediate family members, and maybe you do help out a relative. Maybe it's preparing a meal and maybe going over and dropping it off. I just feel there needs to be just an extra measure of protection this upcoming Thanksgiving. And this isn't going to be forever. The vaccine will be coming, and we're all going to have a new sense of normal coming out of 2020 into a more normalized condition that we're used to. So do continue to protect yourself, your family, your loved ones, your relatives, especially our elders. That's going to be absolutely vital and critical from now until those vaccines can reach that older population. So until we talk again, what is next week? Next week is Thursday. Who knows? Maybe we can have a special town hall, perhaps Wednesday, the day before Thanksgiving, and maybe any last minute tips and suggestions on how to mitigate Thanksgiving weekend. So until next week, always glad to talk to everybody and see everyone. So until next week, stay strong, everybody, and we'll talk again. Take care.